Hello and welcome back to the Bryan Laskin podcast. I'm excited that you're here, and man, I have a great topic, I think, today. I'm super jazzed up to talk about it. I think it is going to be a paradigm shift in many people's mind listening today, and I think it's going to be one of the most important topics. If you run a DSO, if you run a group practice, if you are in a leadership position in a dental practice, I think this is going to be one of the most important messages, quite possibly, that you'll hear all year. And what we're going to be talking about today is one of the most effective uses of AI in dentistry today. Now, before you turn off and go, I hate talking about AI, different perspective today. We're going to be talking about how AI is changing dentistry in a big way, in a way that you might not be thinking about, and in a way that I think you'll want to hear about. So I believe that one of the most important, and certainly what I believe is the most frequent use of AI in dentistry, is what we're going to be talking about. And if you disagree, if you agree, I'd love to hear your comments below about this topic because it's fresh and it's important. I don't think that the most frequent use of AI in dentistry, probably not the dentist, it's not the hygienist, it's not even insurance companies or billing or the radiologist. If you know me, you probably know where I'm headed with this now. It is the patient sitting at home using ChatGPT to say, or Claude to say, do I really need to have this dental treatment done? And so right there, probably some hair on some people's necks are going up, going, oh, I hate that. I hate when people come in and say, my ChatGPT said this, right? We're going to be talking about that today and why I think you should be happy that people are asking that. But let's start off by thinking about a patient that comes in, they're diagnosed with a crown, scaling and rip planing, an implant. Maybe they have a large treatment plan. Maybe it's a small treatment plan, right? And you describe it to them, and you use plain language. They get it. They nod in the chair. They take your insurance estimate if you give them one. Then they say, well, I need to check my work schedule. But at night, they go home and they pull up Claude and they ask, do I really need to have this treatment done? Think about it this way. The second opinion used to come from another dentist, but now it more than likely is coming from AI before the patient ever calls another office. In fact, it could be coming before they even leave yours. If you go process an x-ray and you told the patient they probably need to have a crown, they might whip out their phone, go straight to ChatGPT and say, hey, do I need to have a crown? Now, this is not science fiction, my friends. This is happening all the time right now. How do I know? Because I've asked people, right? You can ask your patients. Have you ever asked AI? They might not tell you the truth, but they are. So the question is not whether patients are going to use AI. The question is whether you are ready for what happens when they do. Most dental AI conversations focus on the provider side today. When we talk about AI, we're talking about radiographic interpretation, doing scribe notification, note generation, claim review, automating scheduling, phone bots, practice analytics, all of these things which have value, and some more than others, frankly. But I would argue the most common use of AI in dentistry is, again, much, much simpler. It's patients using AI to understand, question, compare, or delay care that they were just diagnosed with. And think about it. AI, for the most part, is meant to agree with the patient. And patients who are questioning the treatment will nudge AI to validate their want to delay treatment. Now, here's an important nuance. I don't think this is bad. I think this is really good that patients go to AI. Why? Because patients just want to understand their care, and understanding their care is a great thing, right? The danger is when patients ask AI without the context that we have. AI is not creating patient uncertainty. It's exposing uncertainty that's already there. I'm going to say it again because I think it's a key thing to think about. AI does not create patient uncertainty. It exposes uncertainty that's already there. So last month in my LinkedIn newsletter that's called Connected Dentistry, if you haven't subscribed, go to LinkedIn right now, Connected Dentistry newsletter and subscribe. We talked about whether AI can trust the data inside your organization. But this month, I want to flip this question forward. What happens when the patient takes an incomplete explanation, a confusing estimate, a half-remembered diagnosis, because people don't listen when we talk to them, so they only half remember what we tell them. Let's phrase it, it's probably more like 10%. And they put that into an AI tool and ask for guidance. In our practices, in our DSOs, internal AI needs to leverage trusted data. That's why data governance is so important. For patients, patient AI, when the patient's using AI, they need the trusted context. When the patient leaves your practice without context, AI is going to fill that gap, and it's usually not going to be in anyone's best interest. So the real problem that we have is AI after or even during the dental appointment. That's where this breakdown usually happens, is after diagnosis. The dentist explains treatment. The patient hears only part of it. It's not, again, this is not dental team's fault. It's everybody's busy, and it's really hard to make sure that everybody, and even if you gave them the perfect explanation, they're not, and they even remembered it, they wouldn't ask the question in the right context to AI. And if, we give patients an estimate, it's no matter what estimate we charge, whatever we charge, it's going to feel large to patients. And insurance is going to be always unclear. So the patient then has to think about it because they're confused, and your team's busy, right? So follow-up becomes generic or inconsistent. And this is the moment where AI enters the scene. Patients then ask, do I need a crown? Can I wait on a root canal? Is a deep cleaning a scam that my dentist is asking? Why is my dental treatment so expensive? What happens if I delay an implant? Is this dentist overdiagnosing me? Now, why do I know that that's what patients are asking AI? Because I asked AI, right? And in fact, I asked ChatGPT, do I really need a crown? And the response it gave me was a little shocking. It started with, maybe a crown is sometimes absolutely the right move, but you need a crown should come with a clear reason. Okay, so ChatGPT, when I said, do I need a crown? It said, maybe you should have a clear reason. Again, even ChatGPT demands clarity from us as providers. And the patient might not have a confident answer. So I did not follow up with, I didn't get a clear answer. It would be interesting to see how that would go. But, the patient specific, the patient asks a question, but doesn't get a patient specific response. And by that, I mean the right answer for that patient. Why does this happen? Because AI usually doesn't have access to x-rays, photos, periostatus, caries risk, symptoms, bite forces, existing restorations that the patient has, their dental history, their medical history. It doesn't think about progression over time for that patient, the actual clinical reasoning that you made the diagnosis in the first place. The problem is not that patients are asking better questions. I think it's great that patients are asking these questions. And frankly, I don't think the problem is that they're asking AI. The problem is that they are often asking these questions without access to their records, the context, and the information that the care team used to make the diagnosis meaningful. And this leads to, I think, a new category of patient leakage that hopefully you'll allow me to introduce this new phrase called the AI patient leakage. AI patient leakage is what happens when patients don't have clarity, confidence, or momentum after diagnosis, and they take their uncertainty to AI outside of their care journey and into the AI sphere. This can show up many ways: unscheduled treatment, delayed treatment, no-showing, cancellations. Then the patient, after asking AI, then they ask for a second opinion from a dentist. They price shopping, failure to return to your practice, confused people, just basically lower case acceptance and lower completed care, lower revenue, weakened trust. Patients don't reject care in the chair. They leak out of care after the appointment. And, this is not a clinical communication issue. It's not even a scheduling or treatment presentation issue, because even if you do it perfectly again, there's going to be a gap. It's an operational issue. It's a revenue issue. It's a patient experience issue. And most importantly, it's a technology gap issue that we need to close. So in June's newsletter, I offered some quick wins, including including establishing common definitions for treatment completion, referral completion, patient retention across locations. And in this month's newsletter, the natural next question is whether groups can measure where patient momentum breaks down after diagnosis. So that's why I created what we're calling the Patient AI Readiness Checklist. And there's around this presentation, you can give us your address and we'll send you one. And at the end of this podcast, I'll tell you how to get hold of it. But I want to give you an overview of what the Patient AI Readiness Checklist is, because there's quite a few elements that we go into detail in the checklist. So including number one, patient clarity. Do patients leave understanding what was diagnosed, why it matters, what happens if they wait, and what to do next? If the patient can't explain the treatment to their spouse in easy language, they're probably confused and can't confidently accept treatment in the first place. So that's why it's number one. Number two, patient context. Can patients access their important information, their radiographs or images, their treatment plans with the context needed to understand their care? Patients need more than a procedure code and an estimate. They need access to their images again, treatment status, and the rationale that you're doing the diagnosis in the first place. So that if they ask AI, they're not just going from memory, because if they go from memory, the answer will likely be incomplete or agree with the patient wanting to delay. This is why patient-facing access to their care matters so much. And, of course, that's what we've built out within our patient application care, where patients will have access to that information. So if they go to AI, AI will have the context. The future, I believe, is not just telling patients, it's helping patients access, understand, and act on their care, because they're already asking AI to do this for them. How about number three, patient questions? When patients have questions after the visit, do you have them come back to the practice? And if so, they're probably disappearing into Google, ChatGPT, Claude, or they might ask for a second opinion from a dentist. So make questions easy to ask through a secure messaging application and route those questions to the right person so it can be asynchronous. Then track the common objections. And importantly, do not shame patients for using AI. You should empower patients who are using AI. I wouldn't recommend patients go use AI, because you don't know if the AI version that they're going to be using is secure. So their private health information could end up into a public AI model. So I would certainly not recommend people use AI, but definitely I would not shame people for using AI. So if you want scripts to give your team, we have that in the AI readiness checklist. So we have scripts for your team to address AI related questions in a way that doesn't shame people and enforces, and it helps elevate your diagnosis. Number four, patient momentum. Can your DSO, your offices, identify which patients are likely to delay, cancel, no-show, or fail to schedule their appointments? Generic reminders are no longer enough. Different patients need different follow-up. A patient delaying because of fear is different than one who delays treatment because of cost. A patient with urgent treatment should be followed up differently than somebody who has an elective case. This is where reminders need to evolve. The next generation of reminders, like ToothApp's Reminders AI, doesn't just confirm an appointment. It has follow-up intelligence. Who needs attention? When do they need it? And what kind of message will actually help them move forward? Again, not science fiction. It's what we're doing today at ToothApps. Number five, patient movement metrics. Can your group measure whether clarity and follow-up are moving patients forward? Can you track diagnosed to scheduled care, scheduled to completed care, follow-up attempts, reasons why people are delaying, no-shows by treatment type, cancellations by treatment type, completed care by location, by provider, by workflow? If you can't see where patients stall, you can't fix the care journey. You can only blame the patient, blame the team, or just do a WAG, a wild guess. So the most successful DSOs, I believe, will certainly not be the ones that tell patients to not use AI. They will give patients better information before the patients ask AI. They'll make records easier to access for patients to provide context for the diagnosis. They'll explain care in plain language, invite questions after the appointment, and make it easy for patients to securely ask those questions and get them answered. They'll use smarter follow-ups, measure patient movement, and treat post-diagnosis communication as part of care, not admin work. Post-diagnosis communication is key. It's not when the patient's in the chair, it's when they leave. And that should be leveraging technology to automate, because guess what? Our teams are overwhelmed already. Here's what's key. The organizations that will win are not the ones that stop patients from using AI. That's impossible. They'll be the ones that make sure patients have better context before they go to AI. At Tooth Apps in Care, that's exactly the kind of problem that we're building around, helping patients access, understand, act on their care while helping practices see where follow-up and patient momentum breaks down. So some practical takeaways from today. I've got three. Well, I'll give you a bonus. Number 0 is make sure to get the AI readiness checklist. So reach out to us, and I'll talk about that after I go through the 3 immediate takeaways. Number 1, review your treatment explanations. Ask, if you explain treatment this way, would the patient understand it 24 hours later? If not, it's probably too complicated. Can they explain it to a spouse? Would it help them ask better questions? Does it include urgency and a next step? Number 2, audit your post-diagnosis follow-up. Ask, who follows up when, what's the message, based on what patient behavior, and is it tracked? Number 3, identify where patients are leaking out. Where do diagnosed patients stall? Which procedures have the most delay? Which locations have most unscheduled treatment? Which patients no-show after large recommendations? Which follow-ups are actually moving patients forward? AI did not create leakage. It just made it easier for patients to take their uncertainty somewhere so that they could be validated. Patients are already using AI to interpret dental care. The question is whether you are part of that conversation, or if you're burying your head in the sand and reacting after the patient already has asked AI. We created the AI patient leakage checklist to help groups like yours and leaders in dentistry identify where patients lose clarity, confidence, and momentum after your diagnosis. If you want a copy, join our list or message me with the word AI and I'll send you a copy. The future of AI in dentistry is not only inside the operatory. It's what happens after the patient leaves and how we proactively prepare for patients to interact with AI. Hope you enjoyed today's podcast. Again, I think it's a controversial take on AI, but I think it's an undiscussed issue in our industry right now that I'd love to start the conversation here. So what do you think? Do you think that patients are using AI? And if so, is it a good thing? Is it a bad thing? Or you think I'm full of it and patients aren't asking AI because your treatment recommendations are so clear? Let me know. And again, I look forward to seeing you next time right here on the Bryan Laskin Podcast.